Looking at the scar that results from a cesarean section, a C-section, you can have a scar that comes across here to get the baby out, or you can have one that's vertical up closer to the belly button. And so the visual scar that we can see is only what we call the tip of the iceberg. So you can see this line of tension from here, but what we feel with our hands is how deep is that tension actually going, and what other organs is it related to? Is it coming down to the right ovary? Is it coming, is there a line of tension, scar tissue down to the bladder, maybe to all of the intestine tubes here, or the peritoneum, the covering around the abdominal organs. So we do want to work these different scars that we can see, but we also want to be able to feel the deeper structures and see how that might be affecting breathing, pelvic floor health, digestion, core activation, lower back pain. Complementary homework things that we give patients post C-section. We usually see them around 6 weeks, which is when the tissues are starting to really heal up and close. So if the scar is closed and not infected, we will teach them a little bit of work with their hands around that scar. So just being able to get things moving with their body in different positions, seated versus laying down. And then we will also use the corgeous ball. This is the grippy yoga tune-up ball. And what we love about this is it allows, sometimes it's a little weird for patients to touch their own scar tissue. So this can allow for a grippy sensation to grab the skin and kind of work the tissue in different directions. So you can spin different circles, you can come up, down, you can play with your hip in a different position and kind of work that way.
Coming on the back, have them play with different positions when they're on their back. So I can grab some tissue here, some skin, and play with dropping my leg out to the side, maybe straightening that leg, and just seeing where the tension is in the body and just trying to help mobilize that while we are also working the deeper structures with our hands in the appointment.